Welcome to Marney's Minutes, where I share my advice, lessons learned, and best practices on various topics. On today's Consulting with the MedTech industry, we will discuss how to ramp up your existing consulting. Now, this is something that you want to really heavily consider. In fact, as you get busier and busier, not only with patient care, maybe you've gotten some responsibilities with your practice or institution, depending on your practice model, sit down with your significant other, maybe even have a discussion with your partners if that's appropriate, and talk about how much capacity you truly have to take on more consulting. Most likely, if you've gotten in with a company and you've done 1, maybe 2 to 3, I personally always looked for about 2 to 3 experiences with a surgeon before I decided if I was going to bring them up and make them one of the star players, or if I was going to kind of keep them at the current level. And you decide that you're having a great time and you like what you're doing, really be intentional about how much time you have to dedicate. Understand that as you ramp up consulting with the company, it's more time for conference calls. It's more time for reviewing materials. It's more time creating slide decks, especially if you're not going to do the same thing over and over. You're going to be creating multiple slide decks, and that does take time. When you're away from your family, you're being flown all over the country. And when you're away from your practice, that all seems exciting, and it's very orthopedic celebrity, as I've heard it called. But just remember that your support team at home, both from the family as well as the partners who are dependent and patients who are dependent on you, are the ones that are taking a back seat. So make sure that you're really enjoying what you're doing and you feel like you're making a difference before you try to ramp up. Now, most likely, if you're doing a great job, you won't have to make the ask because they will simply just pull you in. But some nuances and tricks that I can recommend if you want to get busier is A, identify who their current star players are. Most companies have anywhere from 2 to 15 surgeons that you'll see them use consistently. These are the program course chairs. These are the people that are doing everything from medical education to design work. Hopefully there is a mentor amongst them that brought you in, but if you're meeting them for the first time, identify which one that you enjoy the most with, you enjoy the cross-division with the most, that you have the most similar practice styles, or that you quite frankly do the best with when you're put in a panel situation, or if you're doing a rapid fire, or if you're even debating on something. It is key if you want to get busier consulting with a company that at least one or more of their current star players really likes working with you. Because I've seen this happen before. Someone comes in, they might get a little too excited. They might want to steal the show a little too quickly. It detracts from their current KOLs, key opinion leaders, for those of you who haven't heard that term before. And that surgeon might make a couple of calls and suddenly either you're getting reduced in the amount of time or you're getting removed altogether. So make sure to align with people that authentically you get along with, you enjoy being around, and make sure that they enjoy having you teach alongside them as well. Another tip I can give is that every year, the company might change out some of their initiatives. They might focus on a different product that they've come out or a different service. They may be focused on a different surgical approach. So if your practice doesn't incorporate these, you may from one year to the next go from doing anywhere from 5 to 15 educational events with them. Suddenly that phone stops ringing. One of the biggest pieces of advice that I can give, both from the surgeon side and from the industry side, is as a surgeon, don't take it personally. Don't get upset. Don't call your sales rep and start threatening the business. Try to understand either if there was something that you could do better or if they simply switched their initiatives. If they did switch their initiatives and it turns out something you also do, let that be known to both the person that you were working with previously or to your sales rep and say, hey, it turns out I do that, or I've been thinking about trying that. Is there some way that I could get involved? From the industry side, don't just suddenly let this go cold. One of the biggest things that you can do to really upset one of your key opinion leading surgeons is to go from a ton of activity with them one year into nothing the next with no conversation. What I found in having some difficult conversations with surgeons, especially when it comes to working with them, is as long as you give them the chance to sit down with you, to really understand why the focus has shifted, to maybe even open the opportunity of, hey, are these things that you're either doing or interested in so that they can come along board. But if, quite frankly, they just say that that's not something that they're going to bring into their practice, let them know we love working with you. As soon as we're refocused or we think something fits in your wheelhouse or is of interest, we'll get back to you and we'll bring you back in. So those are the tricks and the tips that I have on how to ramp up once you get your foot in the door and you start consulting with companies that you really enjoy. Thanks for watching Marney's Minutes. If you found today's topic useful, don't forget to like the video and subscribe to my channel.